Good morning to our media partners and those watching on DOH social media channels. Welcome to today's Media Forum, Monday, November 15. Now, to open our media forum, may I call on Yusek Maria Rosario Singh Berheret. Good morning po, Yusek.
Good morning and good morning to all of you. Welcome to our Monday's COVID-19 Media Forum, November 15. Sa mga susunod na linggo, ipapatupad na po natin ang iba pang ang alert level system sa iba pa hong mga lalawigan sa ating bansa. Muli po nating pinapaalala ang pagtatanggal ng mga malawakang quarantine restrictions ay hindi nangangahulugang dapat po tayo maging kampante. Narito pa rin po ang banta ng COVID-19 at lahat po tayo mahalaga ang papel para sa tuloy-tuloy na pagbaba ng kaso sa ating bansa. Ang sama-sama po nating pagsunod sa minimum public health standards ng tamang pagsuot ng mask, pag-obserba ng physical distancing, pag-iwas sa 3 Cs, yung closed, crowded at close contact settings at palagi ang pag-uugas ng kamay ay makakatulong upang makontrol natin ang pagkalat ng sakit, lalo pa ho na ngayon na parating na po ang holiday season. Muli po naming pinapaalala sa mga local government units na habang bumababa po ang kaso ng COVID-19 at unti-unti nating nabubuksan ang ating ekonomiya, ay pabalisin pa rin po natin ang paghahanap ng mga nagkakasakit at agad po silang ma-isolate upang mapigilan ang pagkalat ng sakit sa ating komunidad. Dapat po nating ipatupad ang minimum public health standards sa lahat ng establishmentong inyong nasasakupan. Mahalaga rin po na pataasin natin ang vaccine coverage, lalong-lalo na sa senior citizens at those persons with comorbidities na silang mas nanganganib na magkaroon ng severe COVID-19. Patuloy pong hinihikayat ng Kagawaran ng Kalusugan ang lahat ng hindi pa nababakunahan, ngunit kasama na sa eligible population na magpabakuna na po tayo. Ang mga bakunang ito ay napatunayan na naligtas at saka mabisa laban sa malalang COVID-19 na maaring magdulot ng pagka-ospital at pagkamatay. So now let's move on to the national COVID-19 situationer and biosurveillance updates. Next slide. As of November 12, we have sequenced 20,055 samples, of which 89.38% have assigned lineages. The latest run comprised of 666 samples collected in March, September, October, and November. Of this, 1 case was positive for the Alpha variant and 94.59% or 630 were positive for the Delta variant. There were no samples positive for the Beta variant not detected in the latest run. Also, of the total sequence samples, incoming international travelers comprised of 5.85%. We are doing retrospective sampling to trace the beginnings of the Delta variant, introduction to the country, as well as the earliest cases. Of the 17,925 sample sequence assigned with a lineage as of November 12, 36.89% of samples were positive for the Delta variant, 19.96% for the Beta variant, 17.46% for the Alpha variant, and 0.02% or 3 samples were positive for the Gamma variant. Among all the sequence samples in the Philippines, 74.3% of the 17,925 samples with assigned lineages were positive for the Alpha, the Beta, or the Delta variant. All the 17 regions either have an Alpha, a Beta, or a Delta variant case. In the National Capital Region, all cities and the lone municipality were found to have a variant of concern. Also, 805 or 68.7% of the returning overseas Filipinos were positive for a variant of concern. A gradual increase in the proportion of variants of concern with respect to the total sample sequence has been seen at the national level since the detection of the first local Alpha and Beta variant cases. The variant of concern cases only accounted for 24.8% of the samples collected in the month of February. In March, however, variant of concern cases comprised 82.2% of the total samples. This increase has been consistent for the succeeding months. At present, for samples collected in October, variant of concern cases now comprise about 99.3%, and all 5 samples with collection dates in November tested positive for the Delta variant. More samples collected in November are needed to determine proportion of lineages for samples collected for the aforementioned month. In addition, similar to the other variants of concern, since the detection of the first local Delta variant case collected in April, an increase in the proportion of Delta variant cases were seen for the succeeding months. The increased proportion of these variants can be attributed to their increased transmissibility. However, sampling methodology also affects these proportions as samples from target areas or populations are prioritized more. Such population or areas include samples belonging to clusters, severe or critical cases, admitted cases, samples from areas with sudden increase in COVID-19 cases, fully vaccinated individuals, and cases from returning overseas Filipinos. In addition to purposive sampling, the number of samples sequenced varied from month to month due to the limited resources available. Targeted population had been prioritized in the sequencing runs done from May to June, which may have contributed to the skew of the variant of concern cases for these months. On November 14, 1,926 cases were recorded, bringing the total reported confirmed cases to 2,816,980, of which 1% are active cases, 97.38% are recoveries, and 1.62% are deaths. Looking more closely at our active cases, 85% of these are either asymptomatic, mild, or moderate. For November 14, the top 5 regions contributing to these new cases are NCR, Region 2, 4A, CAR, and Region 7. And the top 5 areas contributing to the new cases are Quezon City, Isabela, Negros Oriental, Nueva Vizcaya, and Zamboanga City. Our epidemic curve shows that the current average daily cases have further decreased by 353 cases or 15% this week. Nationally, we remain at low-risk case classification with a negative 2-week growth rate at negative 55% and moderate risk average daily attack rate at 1.96 cases per every 100,000 individuals. The national health system's capacity is at low risk. Majority of the regions are at minimal to low-risk case classification. CAR as the only region that remained with high-risk average daily attack rate and is at moderate risk case classification. For regions with either total bed or ICU utilization at moderate risk, and these are CAR, Region 4B, Region 9, and Region 2. The NCR is currently at low-risk case classification with a negative 2-week growth rate and a DAR that decreased to 3.01 per 100,000 population. However, the region shows a positive 2-week growth rate in the recent week, but its total bed and ICU are both at low risk. In NCR, the daily cases in the recent weeks have plateaued with its 7-day moving average, showing 435 average daily reported cases for the week of November 8 to November 14. National admissions have also been on a decline, currently at low-risk utilization at 27% capacity. Dedicated beds have also decreased since the start of October. Compared to July, the current dedicated beds are higher by 2,896 and admissions are lower by 5,822 or 36%. ICU admissions have also been on a steady decline and is currently at low risk utilization. The dedicated ICU beds have also been decreasing since the start of October. Compared to July, the current dedicated ICU beds are higher by 292 and the ICU admissions are lower by 593 or 32%. The national deaths peaked in September along with the decline of our cases. We see that weekly deaths are also on a downward trend since the start of October. Partial data for November reports 345 deaths or an average of 25 deaths per day. I would like to highlight the following key messages. Nationally, we remain at low risk case classification with a negative 2-week growth rate. As we safely reopen the economy, we remind everybody not to be complacent and lower our COVID-19 cases by strengthening gatekeeping at all levels. The local governments must continue to do active case finding to further cut the transmission of COVID-19 and ramp up our vaccination efforts to ensure coverage, especially among senior citizens and those with underlying conditions. Everyone should continue to adhere to the minimum public health standards and avoid the 3C settings even if we are fully vaccinated already. Over to you, John.
Thank you, Yusek, for giving us the national situationer. For our media questions, we go straight to the question of Caroline Bongkin from CNN Philippines. For our first question, may mga nai-report na po ba na clustering ng cases mula dahil sa filing of candidacy? May update po ba ng binabantayang clustering? Saan po ito?
Yes, Caroline, no? Sa ngayon, wala naman tayong naire-report na clustering among these different offices that are concerned, no? Dito sa mga filing of candidacies and the other election processes. So wala pa ho tayong nanonote for that, no reports for that. But one thing I can tell you would be na kapag po nagkakaroon tayo ng mga incidents like this, we need to wait for 2 to 3 weeks before we can be able to determine if there was this significant increase or there would be clusters that will be identified. So antayin lang po natin, we are closely observing and monitoring, and hopefully po sa mga susunod na araw, ito pong mga ganitong activities will be compliant with our safety protocols.
Thank you po, Yusek. For the next question from Sheila Crisostomo of the Philippine Star, has the DOH already issued the administrative order allowing hospitals to procure Ronalpreve? Bakit kailangan pa ng AO kung meron ng EUA from FDA? May recommendation na po ba ang HTAC and Living CPG?
Yes, Sheila, no? Itong Ronapriv kasi nabigyan siya ng Emergency Use Authority. So for us to be able to procure, ang nakalagay lagi kapag ka Emergency Use Authority, DOH ang pwedeng mag-procure. So for us to be able to facilitate the process and hindi tayo magkaroon ng bottlenecks in our, to facilitate the provision of this drug to our hospitals at ma-decentralize natin, gumawa tayo ng administrative order. It is a general prescription kung saan lahat ng magkakaroon ng EUA na investigational drugs, we are already giving authority to our local government, to our hospitals and local governments for them to procure this type of drug. So hindi na kailangang DOH pa ang bumili tapos magpapa-allocate pa sa lahat ng ospital para mas mabilis at magamit agad ng ating mga kababayang nangangailangan ng mga ganitong gamot. This AO serves to provide that authority to all of our implementing units so that they can procure on their own.
Thank you po, Yusek, for the clarification. For the next question of Sheila, please give us latest COVID-19 with breakdown by age, and may observe na po bang pagtaas ng kaso sa mga bata?
Sheila, ngayon, yung monitoring natin and analysis, no, it's still the same trends across all age groups. No? So kung ano yung mataas talaga would be our 30 to 59 years old, no, pagdating sa mga kaso. Pero yung mga sa kabataan, pareho pa rin ang ating obserbasyon sa ngayon. We just have started de-escalating NCR to alert level 2 last week. We have just started implementing itong mga minors or senior citizens that can go out. So titignan po natin in the coming weeks, 2 to 3 weeks from the time that we've started implementing, how it's going to make a difference in terms of the cases that we report per day.
Thank you po, Yusek. The next question is from Aiko Miguel of UNTV. Will the DOH recommend po age restriction for minors in malls or shorten time in malls?
Actually, Aiko, these are local government units authority already. The national government through the IATF has issued the resolution wherein we have de-escalated the national capital region into level 2. So itong level 2 na ito, meron tayong mga protocols na kasama dyan. Kasama dyan, 50% capacity lang sa establishments, 70% sa outside places. So kung mapapansin natin, medyo sa tingin natin exceeding capacity itong mga establishments, no, na checking on the capacity of their facilities at pumupunta ang mga tao dyan. So kailangan it will work both ways. Kailangan ang mga establishments should be able to comply with what was issued as a policy by the IATF with regard to the capacity of their establishments. Sa isang banda naman, kailangan ng ating local governments maipatupad at mai-enforce itong sinasabi nating mga polisiya na ito. So there should be strict enforcement on the required capacity for the establishment in alert level 2 areas. Pangatlo, kailangan yung ating mga kababayan din. Makita din natin na kailangan kung sakasakaling kailangan nating lumabas, kung pupunta tayo sa mataong lugar, wag na po natin isama ang ating mga kabataan. Please remember, the very reason why children were allowed to go out, it's because of their health. And because it is because of their health, the three major reasons why we wanted them out was because they can exercise outside, they can get sunlight, they can interact with other children, but not for them to be brought into these crowded establishments like malls. So sana po ang ating mga magulang, ang ating mga guardians, kapag nakita ho natin na medyo maskip na po yung pupuntahan natin, wag na muna po natin po isama ang ating mga anak para makaiwas po sa mga ganitong mga sakit. Lagi natin tatandaan, ang mga bata po less than 5 years old are not required to wear face mask. Dahil baka mahirapan po silang huminga, hindi po sila makapagsabi sa atin na nahihirapan na pala sila. Kaya po sila, pag dinala natin sa mga crowded na lugar, wala po silang proteksyon katulad natin na pwede tayo magsuot ng face mask para sa sarili natin. So let us all remember that. Let us try to be more cautious at lagi po natin protektahan ang ating mga kabataan.
Thank you po, Yusek, for the clarification. Another question from Aiko Miguel. May update na po ba sa WHO SAGE recommendation on the administration of third or booster shots?
Wala pa, no, Aiko. Hanggang sa ngayon, inaantay pa rin natin na lumabas yung completed SAGE recommendations. Atin po yung inaantay, ang commitment sa atin dati ng WHO, it will be out by November. But as to when, this November, hindi pa ho natin alam. So antayin po lang natin because this will be one of the inputs dun po sa ginagawa nating evaluation for these boosters. Although, of course, nag-umpisa na ho ang evaluation, meron ho tayong mga vaccine experts, meron naman ho tayong mga ginamit na ebidensya, galing din po yan sa mga pag-aaral across the globe. At ito po ang ginagamit ngayon ng Food and Drug Administration and our vaccine experts for them to evaluate if EUA can be amended for these boosters.
Thank you po, Yusek. The next question is from Donna Pazibugan of the Philippine Daily Inquirer. For our first question, NCR has been under alert level 2 for more than a week. Are there warning indicators so far that the loosened restrictions may be reversed?
Well, Donna, meron tayong metrics na ginagamit, no? So katulad nga ng sabi namin, hindi siya mararamdaman pa kung sakasakali kung tataas o bababa as an effect of this de-escalation to alert level 2. Makikita ho natin yung mga effects na yan, mga 2 to 3 weeks from the time that we have implemented. But of course, ang ating mga warning na nakikita natin, mobility is increasing. Nakikita natin na marami po yung mga crowded areas sa ngayon, and that should serve as a warning for all of us. Now, if this will continue on, yung risk po o yung probabilidad na tumaas uli ang mga kaso in the coming weeks ay naandyan. Kaya dapat lahat tayo very cautious, lahat tayo alam natin na we should comply with the safety protocols, and local governments and establishments should also be able to enforce itong safety protocols para hindi na po tayo uli magkaroon ng mataas na kaso. Sorry. Okay, Jolo, go ahead.
Okay po. For the next question of Donna Pazibugan, how many COVID-19 vaccines were wasted or can't be used, and what is the reason?
Well, we've answered this already, Donna, no? Majority of the causes of vaccine wastage were temperature excursions, transport, absence ng label dun sa mismong bakuna. Yung iba naman merong particulate matter, no, dun sa ilalim na nagsisettle dun sa bakuna. Kapag ganun, hindi na po ginagamit yan ng ating vaccinators. Pero ang pinakamalaki po na naging wastage natin would be, alam po natin lahat, yung pagkasunog dun sa pagadian, no? And this comprised the majority of the portion of those wasted vaccines.
Thank you po, Yusek. I will now be moving on to the Zoom chat questions of our media partners. So for the first question from Caroline Bonkin, please explain why there is a decision to allow voluntary use of face shield for alert level 1 and 2 areas. What did health experts say about this during the meeting last week?
For now, I cannot answer this really, Caroline. I hope you understand. It is going to be the Office of the President to explain and to give information to the public once the President has decided on this already. So please understand us and our apologies, but I cannot answer this question for now.
Thank you po, Yusek, for the clarification. So for the next question of Caroline, sang-ayon po ba ang DOH na higpitan uli ang pagpunta ng mga bata sa mall dahil sa mga naitatalang kaso ng mga bata?
Yes, Caroline, kailangan maintindihan natin. Unang-una, yung article po last week, this was an isolated case. So let us not try to parang ma-interpret natin na kailangan magsara na uli kasi meron po tayong report na ganito. Siguro, ang kailangan natin pagtuunan ng pansin ngayon, how we better inform and advise itong mga magulang, mga guardians, pati yung mga establishments natin at local governments. Katulad ng sabi ko kanina, local governments will have that authority kung sa kanila ay magkakaroon sila ng pagpapatupad, kung magkakaroon ng konting restrictions no dito sa mall, especially in terms of allowing minors inside. Pangalawa, kailangan ang mga establishments din natin should be able to comply with the capacity na binibigay sa atin for this alert level 2. So pangatlo, of course, yung ating mga magulang. Na katulad nga ng sabi ko, ang pangunahing objective po para po tayo ay kaya natin inalaw ang minors lumabas is for their health, no? Mental health and physical health. Magkaroon ng exposure sa sun, maka-interact sa ibang bata, makapag-exercise, makalabas-labas outside of their homes. Pero pag nakita na ho natin na masikip yung mga lugar, wag muna po natin dadali ng ating mga kabataan dyan. So I think it doesn't have to be that tatanggalin natin uli yung pag-aalaw sa minors sa labas. Kailangan ho lang talaga magtulong-tulong tayo para maipagpatuloy natin na pati ang mga bata ay nakakalabas ng bahay at hindi nakakulong, lalong-lalo na that we are going to have our face-to-face classes already. So let's all try to comply with the protocols that we have so that everybody gets safe.
Thank you po, Yusek. Another question po from Caroline. Follow-up po sa presentation ni Yusek, kailan po nag-start ang retrospective sampling to determine origin of Delta in the Philippines? Gaano po ito ka-importante?
Importante siya kasi sabi natin, itong aming ginagawang biosurveillance, it is not just for us to tell you na, oy, meron ng Delta variant, meron na tayong Beta, may Alpha. Kailangan namin malaman ano yung naging source, kailan pumasok ang mga ganitong variant sa ating bansa. This is part of our biosurveillance. So we started this retrospective sampling. I think it started off last June when we started getting samples also from April and May. Dahil doon natin unang naitala na nakakita tayo at nakadetect ng Delta variant. So gusto natin makita as to the specific area and the specific time frame kung kailan pumasok itong ganitong klaseng variant dito sa ating bansa.
Thank you po, Yusek, for the clarification. The next question is from Maki Polido from GMA. Consulting firm Okta says there is an increase in cases and reproduction rate. They're not saying it's already a trend, but is DOH concerned po?
Maki, sa amin naman galing yung mga datos na ginagamit ng Okta. So whatever they monitor, we also monitor. But we are not alarming people over this kind of increases and decreases, then it increases again, it decreases. So marami ho kasi tayong factors na dapat ikonsidera. But definitely kapag nakita natin na yung trend na yan ay patuloy na tumataas, significant na, of course we will inform the public. But for now, there is nothing to worry yet. based on the case metrics na meron tayo, no? Meron ng kaso na nire-report, yung trends natin, yung epidemic curve, yung reproduction number, positivity rate. Wala pa ho tayong ganun dapat ikabahala. Ang akin lang pong gustong ibigay na warning sa lahat ng ating mga kababayan, with the continuous increase in mobility and the increase or the decrease in the compliance to safety protocols, at saka po yung nakikita nating mga crowding, no, sa mga iba't ibang lugar, na andyan yung malaking probabilidad na baka tumaas uli ang ating mga kaso. Kaya kailangan tulong-tulong po tayo. But with this noted observations of OCTA, hindi ho yan kailangan ipaalarma pa o magkaroon ng panic at fear ang ating mga kababayan. Hindi pa ho natin nakikita na significant itong changes na to.
Thank you po, Yusek. The next question is from Rafael Bosano. How near or far is NCR from fulfilling the additional requirements to be de-escalated to alert level 1? Ano po ang baseline threshold for safety seals matapos ang pag-uusap ng IATF? Kakayanin ba ng NCR na makababa sa alert level 1 by December po?
Yes, Rafi, no? So yung kung kakayanin by December, hopefully, no, we can be able to achieve that. Para ikaw maka-de-escalate ka sa alert level 1, lahat ng areas kailangan ang iyong low risk case classification ma-sustain mo for 2 incubation periods. So ibig sabihin, kung ikaw ay na-classify namin as low risk start ng November 1, i-observe ka namin ng 2 incubation period hanggang end of November if you can sustain this low risk na classification dito sa area. Aside from that, kailangan meron kang vaccination coverage, 70% for senior citizens, 70% for those with comorbidities, and at least 50% of your targeted eligible population, bakunado mo. So dito sa NCR, we have more than 70% of senior citizens vaccinated. Their target eligible population, more than 50% na rin bakunado. Ang medyo hinahabol lang po nila ngayon, yun pong mga individuals with comorbidities na hindi pa nila na-achieve na 70%. Aside from vaccination coverage, safety seal is also being considered by IATF. Pinag-uusapan po natin ngayon kung ano yung threshold na dapat natin for establishments to have safety seal. This is further safeguards for our public kapag tayo ay nag-de-escalate sa alert level 1. Ibig sabihin, aside from being vaccinated, sigurado rin o mabibigyan ng safeguard ng ating public kasi yung mga pupuntahan nila ay makakasiguro tayo na meron silang compliance to safety protocols like ventilation at saka yung iba pahong mga minimum public health standards. So itong threshold na to pinag-uusapan pa, Rafi, ngayong Webes siguro madidesisyonan na para maidagdag natin doon sa mga additional requirements natin for alert level 1. So again, let me reiterate, it is not impossible for the National Capital Region to be de-escalated to alert level 1 by December. Pero kailangan masustain natin kung ano man yung gains na meron tayo ngayon, like having this low risk for at least 2 incubation periods or 1 month. And they have to be able to reach the 70% for all this vulnerable population. And kailangan din yung safety seal ay magkaroon ng mga establishments.
Thank you po, Yusek. The next question is from Christian Day pa rin of philstar.com. On the start of limited face-to-face classes po sana, does DOH believe plastic barriers per student in classrooms will really help prevent the transmission of COVID-19?
Itong plastic barriers, it depends on how we are able to implement that, no? Yung sa mga jeep po kasi plastic, 'di ba? Tapos kapag nagalaw ng isang tao, napupunta sa mukha ng isang tao, so parang hindi rin po siya naging effective para gamitin para to prevent infections. Dito po sa eskwelahan, nakakita ako may mga acrylic barriers yung ibang eskwelahan. I think that would be more appropriate. But we also understand that because of limited resources, hindi lahat ng eskwelahan ay maaring magkaroon ng ganito. So ang pinaka-effective pa rin na gagawin natin, magkaroon ng adequate ventilation sa classroom, minimal capacity lang sa loob ng kwarto. At meron naman ho tayo naging pamantayan dyan, no? Na parang kalahati lang ng kanilang population per classroom or even less ang papasok. And yung ventilation talaga yung maayos na daluyan ng hangin ay kailangan po na andyan. So with or without the plastic barriers, as long as we can comply with the physical distancing, adequate ventilation, and of course, symptomatic screening across the different school children and teaching and non-teaching personnel, ay maaari tayo makapagsiguro ng kaligtasan ng ating kabataan.
Thank you po, Yusek, for the clarification. The next question is from Sheila Crisostomo of Philippine Star. Bakit po hindi mapababa sa low-risk classification ang CAR? Ano po ang ginagawang national government para matulungan ang CAR mapababa ang cases?
Yes, sa CAR kasi, Sheila, yung kanilang healthcare utilization ay medyo nasa mataas pa rin, yung kanilang mga ospital doon. Hindi po sa buong CAR nangyayari ito, no? So meron lang pong piling lugar dito sa Cordillera Administrative Region. Pangalawa, ang kanilang pagtaas ng kaso, hindi po yan sumabay dun sa pagtaas ng kaso dito sa NCR at mga karatig na mga probinsya ng NCR. Yung kanilang peak in cases happened towards the end of September already compared to NCR and its neighboring areas kung saan nag-peak na tayo parang September 11. So kaya po mas na-delay sila sa pagbaba ng kaso at pag-decongest ng kanilang ospital. Assistance, yes, we have provided a lot of assistance already. Continuous ang monitoring natin, continuous ang coordination. Nakapagbigay na rin po tayo ng mga pondo at saka mga equipment sa mga ospital nila. And even testing kits, patuloy po natin silang binibigyan para po atin pong matulungan sila sa pag-address at maputol ang community transmission dito po sa kanilang lugar.
Thank you po, Yusek. Another question po from Rafael Bosano. May update po ba on the mandatory vaccination for on-site workers by December 1? Ano po ang stumbling blocks na nakita natin? Is 100% compliance visible po?
Kung ito po ay mamandato na ng ating mga working facilities, mangyayari naman po yan, that vaccinated, tapos yung hindi bakunado, magpapatest sila para po sila ay magkaroon ng makapagtrabaho. Of course, there would always be stumbling blocks, no? Maraming magiging challenge ang pagpapatupad. Maaring yun pong pagtetest pa lang ay maging stumbling block na para sa pagpapatupad nito. But if it is mandated, the employees has to comply, especially dyan sa private sector, na sila naman po ay may authority to issue this kind of policies para po sa safety ng kanilang mga empleyado.
Thank you po, Yusek. For the last question po, from Gerard Naval, where can we attribute the recent plateauing of cases in NCR po? Was it possibly due to the easing to alert level 2?
Well, Gerald, sabi ko nga, it's still early for us to say, no? Kasi we have just implemented the alert level 2. Katulad ng sagot ko kanina kay Maki, ang ating mga numero po, hindi po siya nagiging constant ba? O pag sinabi nating bababa ay bumababa na talaga ng dire-diretso. Kaya there's plateauing, Minsan magpa-plateau yan, tapos bababa uli. Minsan naman yung plateau na yan, biglang tataas na rin. So we are trying to monitor right now what has been the factors kung bakit nagpa-plateau. Kasi malaking bagay din po dyan yung testing capacity natin, on how many people or individuals are being tested in specific areas. So titignan ho natin, but for now, we cannot attribute this to the de-escalation to alert level 2 because we have just started implementing this. We will see the difference in about 2 to 3 weeks from the time that we started implementing alert level 2. As to the factors on why it is plateauing, we will still observe for this week if this plateau continues or if the decline will also be evident after some days. Tsaka po tayo magbibigay ng eksakto or concrete na mga factors kung bakit nagkaganito after we analyze.
Maraming salamat po, Yusek. That's all the questions we can accommodate for today. And for your final message na lang po, Yusek, to our kababayan.
Yes, sa pagtatapos po ng ating media forum ngayong Lunes, gusto po namin uling magpasalamat sa inyong lahat dahil alam po namin, katulong po namin kayo sa pagpapakalap ng tamang impormasyon sa ating mga kababayan. Gusto lang po namin paulit-ulitin kahit sawang-sawa na po kayo lahat sa aming mga sinasabi Gusto ko lang hong ipaalala sa ating lahat na andito pa ho yung virus, hindi pa rin po tayo tapos sa ating laban sa COVID-19. So let me just remind everybody, let us try to adhere and comply to the minimum public health standards. Hindi lang po tayo as Filipinos, kung hindi kailangan din po ang ating mga local governments bilang mga pangunahin o sila po yung namumuno sa bawat komunidad natin na sana po strictly enforce po nila ang ating mga protocols para hindi po nagkakaroon ng mga crowding, hindi po nagkakaroon ng overcapacity ang ating mga establishments. And to our business sector, ang mga establishments, nananawagan po kami na sana po ipatupad po natin yung protocol na inilabas ng IATF with regards to the capacity for your establishments. Pag nakita na ho natin exceeding capacity na tayo, wag na muna po tayo magpapasok ng further or i-regulate po natin ang pasok ng mga tao para hindi nagkakaroon ng crowding. Alalahanin po natin lahat, nakasalalay sa ating lahat kung patuloy po nating makikita ang pagbaba ng kaso sa ating bansa. Atin pong pagtulong-tulungan at tayo po ay maging cautious and always aware so that we can see a better Christmas for all of us. So maraming salamat po sa inyo and we will see all of you on Friday. Thank you, Jolo.